to the quickest and easiest means of making money, which include murder, theft, armed robbery, etc. Now coming to drug addiction and rape. According to the U.S. Bureau of Statistics, over 9,000 sex offenders were examined, and out of these 9,000 sex offenders, 66%, I repeat, 66% were found out to be addicts. How can you then tell me that drug addiction is not the surest way to criminality in our youth? Then coming to drug addiction and domestic violence, drug addiction, domestic violence, we can all see the relationship between that. Over 72% of reported abuse cases were found out to be committed by people who are addicted to drugs. We are not here to say that drug addiction is the only route to criminality amongst our youth. We are here to say that drug addiction is the surest route. If drug addiction is not the surest route, let our opponent tell us which is. Statistics do not lie. And from the statistics I have given, it is obvious to us here that drug addiction and criminality amongst our youth, there is a strong link between drug addiction and criminality in our youth. Thank you very much.
Can you say that a route to Vuki land is the surest route just because it is the fastest among other brother youths? I'm sure Mr. Bones would disagree. To say that drug addiction is the surest route to criminality among youth is to say that drug addiction is the single guaranteed highway to the kingdom of crime. That is a fallacy. To say that drug addiction is the surest route to criminality among youth is to tell me that 9 out of every 10 criminals are drug addicts. Is it proven anywhere? To say that drug addiction is the surest route to criminality among youth is forgetting that poverty, unemployment, corruption, and many other factors still lie in our world today and are leading to criminality among many people. My wonderful audience, would you sit here and listen to drug addiction being called the surest, the most guaranteed, the single, the most definite route to criminality among youth? Standing on existing protocols, I am Oyebanji Oyeronke, representing Babcock University. To say that drug addiction is the surest route to criminality is to say that every youth who is addicted to drugs can commit a crime. But I tell you, don't forget that with drug addiction comes several physiological changes. Cerebrovascular diseases that affect the brain, cardiovascular diseases that affect the heart, nausea, stroke, seizures, and many other diseases. Can a person who is incapacitated by these factors stand up and commit every single crime in our world today? Can that happen? To say that drug addiction is the surest route to criminality means that with drug addiction, a person can do every single crime. We forget that with drug addiction, with addiction to drugs such as marijuana, which is proven by the United Nations Office on Disease and Crime Prevention as the most used addictive drug, marijuana helps a person to lose coordination. Marijuana makes a person lose his short-term memory. Without your short-term memory and coordination, how can a person execute and plan out organized crimes in our society today? A woman is the surest route of a child's life in this world. So also Aristotle mentioned poverty as the parent of revolution and crime. Today in our world exists poverty that causes 84% of crimes in the United States, which is identified as the most criminalized country in the world by the United Nations Office of Drugs and Crime. Juvenile delinquency gives us 80% of that crime. Disrespect to parents gives us 74%, and drug abuse, not even addiction, gives us only 67%. Compare these facts, compare these statistics, compare the numbers. Drug addiction only gives a smaller number compared to many other factors. Therefore, it is not the surest route to criminality among you. Thank you.
The topic is drug addiction is the surest route to criminality amongst youth. I would like to draw a close attention to surest, the word surest. Surest is an adjective. An adjective has 3 forms: a positive form, a comparative form, and a superlative form. So the argument is the surest route, that is, considering a simple hypothesis
whereby you predict the relationship between an independent variable and a dependent variable. You look for a relationship between them. That is surest. So right now, I didn't say drug addiction is the only route to criminality. No, I said surest. There's a link between independent variable and dependent variable. Now I pose this question to my opponent. Please, if you see a drug addict, a youth that's a drug addict, will you give that person employment? No, you're not going to employ a drug addict. And please, I also want to ask you another question. Can you tell me authoritatively that you've seen a drug addict that is not a criminal? No. No. Crime has different definitions on various levels. Just because you have not carried an AK-47 and stand on the highway does not mean you are not a criminal. So, I would like to speak on other factors. My opponent here has succeeded in telling me that drug addiction is the only way. So, he's telling me it's the only way, not the surest way. So, would you please give me the surest way to criminality amongst youth and not tell me about the only way? Because when you are telling me about the only way, please, I can tell you you are deviating from the topic, which states that drug addiction is the surest route to criminality among youth.
We argued that it was the only and the surest. That was not the basis of our arguments, because I like to believe that that was their position on the debate and not ours. Now, earlier, my opponent said that a thing may not be legally defined, but it may be a crime. Under the criminal codes of all states which I have read, a thing is only a crime when the law says it is. Now, before a person can be said to be an addict, there must be 3 variables, which include repeated use of a psychoactive substance, compulsive and chronological intoxication to the substance, and great difficulty in voluntarily ceasing to use that substance. Now, we established earlier that there is indeed a difference between drug use and drug addiction. If I walk out of Turkish Nile University today and I pick up marijuana and smoke it, I have used drugs. That makes me a drug user. But I am not a drug addict just because I used marijuana today. So there is indeed a sharp contrast between drug use and abuse. And my opponents dwelled basically on crimes that are that are drug-related. Now, we established also in our debate that 80% of inmates in prison today are in jail for drug-related offenses. And I also said that it is possible to test through urine analysis to see if a person is acting with a substance in him. But the fact that a person has used a substance does not mean that the person carried out his action based on the influence of that substance. Because what empirical tests discover is the presence of the substance and not the measurement of the influence on the act of that person. Therefore, you cannot conclusively say that a person has committed an action just because he had a substance in him. He might have committed that crime during his lucid interval. According to reports published in the Commonwealth Pacific in New Zealand in 2008 by the National Health Initiative, it was held that 80% of drug addicts are in remand homes. Babcock University, where I come from, has a rehabilitation center for drug users and drug addicts. And you would all agree with me that I have a couple of friends that have been to the rehab and they are not criminals merely because they are drug addicts. So I can say to you boldly that I have met drug addicts that are not criminals, because most of them are in remand homes. So it is even more difficult for them to commit crimes. You would agree with me. Also, about rape, there is a theory of sublimation in criminal law and criminal theories. It talks about channeling your impulses into things that drain your energy. Now, rapists are not only drug addicts or drug users. A person who has been subjected to the evil parts of the mass media may easily be predisposed to rape another. For example, pornography. So most rapes are not as a result of drug use, but there are so many, a plethora of factors that contribute to rape and not only drug addiction. Also, life is about causes and effects. I will tell you that there are many innate causes that lead to even drug addiction itself. There must have been a cause for there to have been an effect. Now, before a person can decide to start using drugs, something must have caused it. That is, the other surer variables, surer factors that lead to criminality amongst the youth. A child with a background that is dysfunctional is predisposed to drug use that may eventually lead to drug addiction. Thank you very much.
Good afternoon, Mr. Chairman, panel of judges, my fellow co-debaters, and the audience. I pose the question, what is a school without any teachers? It is an empty assertion and assembling of buildings. What are hospitals without doctors? I am here representing Bayes University, and my name is Charles Shukwani, and I'll be arguing strongly and fortuitously in favor of the notion that a large number of physicians and healthcare workers are enough to solve health hazards in Nigeria. I shall begin by disseminating between the key terms in that notion. The first of which is physician, followed by health workers, the word solve, and finally health hazards. Who is a physician? A physician is a professional that practices medicine, which is concerned with the treatment and diagnosis of injury and illness, and restoring and rehabilitating human health. A health worker is an individual that provides healthcare services of a preventive, curative, and rehabilitative manner to people in a systemic organization. A health worker can specialize in surgery, in medicine, in midwifery, in pharmacy, in psychology, in a host of different other allied medical fields. Solve means to find an answer to, an explanation for, or a means of coping with a problem. And lastly, health hazards are anything that poses a problem to or could incur the loss to a person to the health of a person that is exposed to it. Now, if we look at the doctor to population ratio in Nigeria today, we'll find that we are facing a crisis of almost unparalleled sort of crisis in Africa and actually globally as well. In the United Kingdom, which has, according to the World Health Organization, the most efficient and best healthcare system in the world. In 2014, according to Guardian newspaper, they hired over 3,000 foreign specialists because they have a shortage in their own medical industry. And they realized that they need the critical element of any healthcare system, which is physicians and healthcare workers, to fill those systems. But in Nigeria, with a far less efficient healthcare system in the United Kingdom, we have, according to Professor Oluwole Atoyebi, the former national president of the Nigerian Medical Association, we have one doctor for every 20,000 people in Nigeria. How then can we not say that larger doctors, larger numbers of physicians and healthcare workers in Nigeria would surely be enough to solve the health hazards we have in Nigeria today? And we also have to think that with such a shortage of doctors in Nigeria, we have to think about the burden that is being faced by the already existing doctors and the amount of time people have to wait just to see these doctors. If we look at the case of a young boy in Lagos that went to the university, that went to last with the Lagos Student Teaching Hospital in Ikeja, he went in 2009 when he was 5 years old. His name is Abdul Ibrahim, and this is reported in the Punch newspaper. He went and to get a treatment for hernia with his parents. His appointment was delayed for 4 years until 2013. Just his appointment, not even his diagnosis or his treatment. His appointment was delayed for 4 years. And the reason is that there is a backlog of people at these hospitals waiting to get the exact same treatment just for hernia. Think about how many other health hazards we have in Nigeria today. How many people must be waiting day upon day, month after month, year after year, just to get diagnosis and treatment? Because we do not have any doctors, we do not have physicians, we do not have healthcare workers in Nigeria. Now, there are people that would have you believe that corruption is the be-all, end-all of progress in Nigeria. But those people are the enemies of progress, because corruption alone would not stop a large number of health workers and physicians and doctors from solving the health hazards in Nigeria. Why do I say this? If we look at Transparency International, which is an organization that is aimed at calculating the levels of corruption around the world, we will find that Nigeria was ranked 126th in their rating, which is extremely low rating, which means we have a very high level of corruption. However, Russia was ranked 137th in the same rating, meaning Russia has a higher level of corruption than we do. But we have 0.4 physicians for every 1,000 patients in Nigeria, according to the World Bank. Meanwhile, Russia, with a higher corruption rate, has 4.3 physicians for every 1,000 people. They have 10 times the amount of physicians per 1,000 people than we do, with a higher rate of corruption. Corruption should not stop us from employing a large amount of workers, a large amount of health workers and physicians to solve our health hazards in Nigeria. Corruption should not stop us from realizing that this is the critical problem that is attacking our healthcare industry. It is the root from which all other things in the healthcare system can be facilitated through. You need healthcare workers to fill hospitals. You need physicians to fill hospitals. You need pharmacists to prescribe medication. You need physicians. You need nutritionists to provide nutrition. You need so many different types of people, and we do not have it. I repeat again, we have one doctor for every 20,000 people in Nigeria. Now, finally, we have to generate competition in the healthcare industry, and by hiring larger amounts of physicians and healthcare workers, we'll be able to do so, because generating competition generates income. Generate income means more income can be put back into the health industry to solve these health hazards. I'll give you an illustration. In the United States, according to the World Health Organization, the United States has evenly split their healthcare services 21% to 21% between their public and private sector. This generates competition. This is in the spirit of capitalism. What does this do? This has allowed the United States to provide so much money. 17% of their GDP, according to the World Health Organization, has been put back into their economy just from healthcare. That is the highest in the world, because they are generating so much competition, because there are so many private businesses, so many people have invested into the private sector, which has allowed them to generate more income, which can fuel facilities, fuel advancements in technology that are dealing with healthcare, fuel research to be done by healthcare professionals and researchers, which has all promoted to the United States being the world leader in advancements in healthcare today. Also in the United States, the US compared to, and I believe I've been able to make my point succinctly. Thank you.
In regards to the first sentence of my dear opening, a hospital is not all about structures and staff, but about the quality of service delivery. Good day, Mr. Chairman, panel of impartial judges, accurate thank you, my co-debaters, distinguished ladies and gentlemen. My name is Amandi Felix, a final year student of Political Science Department, University of Kapka, and I'm standing here this afternoon to vehemently oppose the motion which states that the large number of physicians and medical practitioners in Nigeria, both in public and private, are enough to settle health hazards in Nigeria. The eradication of polio in Nigeria was a United Nations effort. Over the years, Nigeria has been receiving support from the United Nations. This shows that there is a shortage of shortage in medical personnel and medical practitioners. This afternoon, just as I say, I have the following point to back up my argument. First, brain drain. According to Merriam-Webster, brain drain is the departure of professionals from one country to another, usually because of poor better pay and poor condition of service. In Nigeria, because of poor condition of service, non-payment of salaries and shabby treatment of medics by the government, it has resulted to an acute mass exodus of medical practitioners. You will agree with me that on the 13th of August 2014, President Jonathan sacked about 16,000 medical practitioners because they went on strike. claiming their salaries and wages as well as their interests. Ladies and gentlemen, with Nigerian medical doctors, why would the Nigerian medical doctors leave for greater enjoyment to other countries? To add on that, I want to tell you that the House of Representative Committee on Diaspora recently accounted that about 77% of the black medical doctors in the United States of America are Nigerian medical doctors. Can you imagine? Can we deny a brain drain? Can we? Obviously not. This proof justified beyond reasonable doubt that the available medical personnel in Nigeria are insufficient to render the desired service. That pushed me to the next point. Another undeniable fact that serves beyond reasonable doubt is the small number of students, the small number of medical and paramedical students that are given admission in our universities. Ladies and gentlemen, we do not need to go far looking for a point to justify this point. Let's start with the Turkish Nile University, the host. How many students did the Turkish Nile University graduate last year in medical science? How many? Let me tell you, on the 22nd of June 2014, Turkish Nile University graduated about 184 students. How many were from medical science? How many? Ladies and gentlemen, how is the medical practitioners be enough? When the available medical practitioners be enough? When the available institutions that are supposed to be producing the medical practitioners are not producing them? How would them be enough? It's another fundamental question that you should look upon as we proceed to the next point, which is high mortality and low level of low level of life expectancy. It is a common knowledge that Nigeria has one of the worst life expectancy in the world. This is true. The Internet Journal on Health 2007, volume 8, number 1, recorded that the adjusted average life expectancy of Nigeria is just about 38.3 years. Just about 38.3 years. Ladies and gentlemen, if Nigeria have enough medical personnel and practitioners to solve their health challenges, how do we receive such a horrible life expectancy rate? How? I also live with that question as we proceed to the next and the last point, which is inefficient primary healthcare system. The Nigerian primary healthcare system is in disarray. Where the primary health care system is in work, it is supposed to reduce, help at least tackle health issues at the initial stages. But indeed, in the case of Nigeria, it is not like that. The inefficiency in the Nigerian private health sector is as a result of the inadequate medical staff, lack of physicians, and so on. Ladies and gentlemen, all of these reasons touch beyond the particular point of shortage of physicians, lack of medical personnel, and the issue of medical practitioners. I believe with these few points of mine, I've been able to convince you beyond reasonable doubt that the large number of physicians, medical practitioners, and so on in Nigeria are not enough, and I repeat, are not enough to tackle health challenges in the country. Thank you.
Now, since morning we dey wait, we never see doctor. This is the first stanza of the National Union of Nigerian Patients Waiting for a Doctor, in solidarity with one another. Good morning, the panel of judges, my co-debaters, and ladies and gentlemen of the audience. I would like to start with caution that today the audience are at the chance of being bamboozled and of being convinced with big words and health jargons that the problems in Nigerian healthcare system is insurmountable until we have some other issues, and it cannot be solved by large number of physicians and health workers. But facts and evidence show otherwise. To solve a situation, we have to know what the problem is. What is the problem of our healthcare system? What are our health hazards? The United States Embassy in Nigeria conducted a research in trying to know what the health hazards in Nigeria are. They came to a resolve that malaria alone accounts for 300,000 deaths a year in Nigeria. That is the highest cause of death in Nigeria. That 60% of people who go to hospitals to treat malaria-related illnesses. 97% of Nigerians are liable to be infected with malaria, and the remaining 3 are only safe because they live in highlands that mosquitoes can't get to. Ladies and gentlemen, my point is that our problem in Nigeria are basic healthcare system that need more health workers and health workers to attend to people. We cannot cry more than the bereaved. And the Nigerian delegate of doctors that were sent to the global annual conference in Washington, D.C. cried about the number of employed health workers and physicians in Nigeria. And what has been the result? That 1 out of 13 women who go into child labor stand a chance of dying because there are not enough midwives to attend to them. That 35% of those people are only attended because 35% of those people are attended to by skilled midwives. 145 women in Nigeria who have childbearing age die every single day because of the fact that they are not being attended to by medical health experts. Ladies and gentlemen, I think I need to paint a better picture with this illustration. It is as though Nigeria as a country has agreed that every day we are going to put 145 people into a diner plane and crash them every single day because of our inability to acquire more health workers to attend to them. 52% of children who die below the ages of 5 die because of malnutrition. All these children need a nutritionist, health workers to tell them how to go about their nutrition. These are what we need. These are our basic health problems in this country. We are not trying to be negligible of other complex health situations, but we are saying our problem is this, and our solution is as simple as employing more workers, more physicians, more health workers to tackle these issues. Quick response to emergencies. The best countries with best healthcare system in the world today have only achieved that because of their ability to respond to emergency situations. The Federal Road Safety Corps of Nigeria lamented that deaths by victims of road accidents is the number one cause of death that can be stopped. This means that if we had healthcare workers, paramedics, to attend to these people, they wouldn't have been dying. I'm sure members of the audience have many times seen people, victims of road accident, lying on the floor without any paramedic to attend to them. Ladies and gentlemen, advanced countries such as India, United Arab Emirates, have enough doctors, physicians, and health workers that they have a system called the house call system. This is a system where you call a doctor over to your house to come and treat you. If we have enough health workers in Nigeria, then we'll be able to implement this policy. This means that it is going to cause the time of waiting to see a doctor at hospitals. Issues of bed space and other things will be cancelled. Finally, ladies and gentlemen, I want to draw your attention to the point that our topic today is the large number of physicians and health workers are enough to solve issues of health hazards in Nigeria, and we are supporting the motion. That is to say, we are saying to solve is to give a solution to, is to give an answer to, is to prefer a method of coping with. And we are saying the only medium which Nigeria can successfully solve our health hazard is by employing more health workers, more physicians that know about this situation. Thank you, ladies and gentlemen.
I'm beginning to wonder what the meaning of the word enough means. A man may have 1 million naira. That's a large sum of money. But if he has needs worth more than 1 million naira, the money becomes insufficient, thereby making it not enough. Relating it to this context, the Nigerian health sector, the Nigerian Medical and Dental Council has it that 25,000 practicing doctors are in Nigeria, as against the 170 million people. Oh, what insufficiency. But before I go on, let me give honor to whom honor is due. Good day, Mr. Chairman, impartial judges, accurate timekeeper, co-debaters, ladies and gentlemen. I'm Tara Hembafan Michel, a proud representative of the prestigious University of Muka, standing here to refute the motion which states that a large number of physicians and health practitioners, both public and private in Nigeria, are enough to solve health hazards. With the following points: high maternal mortality rates. Maternal mortality rates refers to the number of pregnant women who die during child delivery. In this context, permit me to replace maternal mortality rates with MMR. According to World Health Organization's World Report in 2013, Nigeria has a worse MMR of 560 per 100,000 live births. South Africa has just 120, and China, on the other hand, has just 30. This is indeed a bad case. This problem has been directly linked to the shortage of professional medics, especially midwives, in Nigeria. According to the Nigeria Demographic and Health Survey 2008, as a result of the shortage of these professional midwives, it has forced the country, that is Nigeria, to resort to the use of, to train hurriedly traditional local birth attendants to attend to these issues. As a result of that, I'm asking you today, can the efficiency of a locally trained midwife and that of a professional midwife be compared? Obviously no. Moving to my next point, which is the health plight of the IDPs. As of April 2015, the IDMC, which is the Internal Displacement Monitoring Center, estimated 1,538,982 destitutes still living across camps in the country in poor health conditions without adequate health personnel to cater for their health needs. Cases of malaria, cholera, etc. have been reported, resulting in many deaths. So I'm beginning to wonder, there may be other factors that lead to these health conditions, but the most important factor is the lack of health personnel, which could help them cater for the needs of these health challenges. Moving me to my last point, which is the rural-urban migration of health personnel. Rural-urban migration of health personnel is simple. This is the movement of professional medics from the rural areas to the urban areas because of so many reasons, one of which is the availability of some medical facilities in the urban areas. I'm from Bagwaza, in the Shungo local government area of Benue State. I cannot boast of one professionally trained medical personnel in my village, and I'm sure it's not too different with any of you here. But my opponents are standing here today to tell me that the medical personnel in Nigeria are enough to take care of health issues. On this note, I rest my case. Thank you. With this solid point of mine, I believe I've been able to convince you that a large number of physicians and health practitioners in Nigeria are not enough, and I repeat, not enough, to solve health hazards in the country. Thank you.
Good afternoon, everyone. My name is Aisha Ibrahim. I'm a student of Base University representing. I'm here to strongly support the motion which says that large number of health workers would be enough for Nigeria to solve Nigeria's health hazard. Firstly, the outbreak of HIV and AIDS, the persistence of malaria, the return of tuberculosis, the occurrence of the SARS and pandemic flu. This is as a result of what? This is as a result of the lack of awareness of people. And how can this problem be solved? This problem can only be solved when there is an increase in the number of health workers so as to pass information to these people and carry on awareness. Now, the CDC, which is the Center for Diseases and Control, for Disease Control and Prevention in the United States of America, has recorded that 850,000 to 950,000 people are infected with HIV and AIDS. Yet, 1/4 of this number are unaware of their infection in a developed country. Now, in an undeveloped country like Nigeria, we know that we're in a case of double jeopardy. There is lack of awareness and there is lack of health personnel. How can this be solved? An increase in the number of health workers. Then we also have the issue of polio. Polio has been eradicated by Nigeria. How was this possible? This was possible due to awareness. And how did awareness come about? Due to the increase of large number of people. Now I propose, if there is an increase in the health workers, if there is an increase in the number of health personnel, then there will be an increase in the public health awareness. And that is a solution to solving our health hazards. Then we also have the issue of the New England American Journal of Medicine proposed that, said that 20% of physicians in the United States of America are specialists. Yet, the CEO of the Sweden Ghana Medical Center said that there are only 20 oncologists in Nigeria to take care of 170 million people. This is unfair, and what we're saying is that the only solution to this is employing a larger number of health workers to be able to combat this issue. We also have that the High Commissioner to India mentioned that there are 20,000 Nigerians traveling annually to go to India to solve health issues. The answer seems to me to be in the obvious for why they are traveling there. They are traveling because there are lack of experts. They are traveling because there are lack of specialists in Nigeria. I propose that there should be a higher number of health workers and specialists and experts so as to reduce the number of people traveling abroad. To further justify my statement, the Minister of Finance said that Nigeria could save 30 billion naira if they will stop going abroad to take care of themselves. This can only be possible if there's an increase in experts and statistics so as to reinforce trust in the medical society. Now, what have I done? I have told you the problem, and Bayes University's team has provided a solution. Thank you.
Good afternoon, the chairman, the moderator, panel of judges, co-debaters, and my audience. I'm Basi Victory, a representative of the University of Mka. I'm here to oppose the motion which says that the large number of physicians and medical personnel are sufficient, or the large number of physicians and medical personnel in Nigeria, both public and private, are enough to solve issues of health hazards. Here are my points. 1, supervision. Supervision, which has been identified as the bedrock of quality services in Nigeria, is seriously lacking due to the shortage of medical personnel in Nigeria. According to Dr. Shea Abimbola, in his quote in nigerianstalk.org, he says that the shortage of supervision cadre is the biggest problem of the Nigerian healthcare system. How then, I ask you, my audience, is it possible for health hazards, note, not just health challenges, but health hazards to be stopped when we have lack of medical personnel? I move to my second point, poor quality of available medical personnel. The United States diplomatic mission in Nigeria states that the quality of medical personnel in Nigeria ranges from poor to fair. Recent graduates from medical science faculties in Nigeria do not have sufficient experiences to cater for patients and to take out sophisticated procedures. Therefore, it is impossible for this number to solve health hazards in this country. Pushing further, respond to health challenges. Senior health officials in Nigeria have cited that the lack of health administrators and health practitioners in Nigeria is the major constraint why response to health challenges it's not at its peak. These challenges include polio, malaria, heart disease, and cancer. Statistics shows that the patient-to-doctor ratio is 53,333 to 1 doctor. Can you imagine? This shows that Nigeria has less medical personnel and the response to diseases is grossly far below expectations. To my last point, patient care. Throughout Nigeria, patients receive limited or not sufficient medications, and they are inadequately addressed by medical personnel. How then do you expect that these health hazards in this country can be solved? Ladies and gentlemen, these issues or these responsibilities become that of the family members in administering medications for their colleagues. This situation is demoralizing. Ladies and gentlemen, I want you to come to the recognition that Nigeria lacks medical personnel, and if health hazards should be solved, we need more medical personnel in this country. Thank you.
Are enough to solve health hazards in Nigeria. That notion is inherently implying that there is a low number of physicians already in Nigeria. And so arguing in favor of the notion means that we are arguing that we then need large numbers of physicians and health workers in Nigeria to solve the health hazards. They are arguing our point for us. They are arguing our point for us. I believe, in my rebuttals, the first speaker mentioned brain drain, that we are losing Nigerian doctors to brain drain. I agree, 10% of Nigerian doctors go abroad as a result of brain drain. That is further proving that we need larger numbers of doctors to solve, and health workers to solve health hazards in Nigeria. That is, again, supporting our point. The first speaker also mentioned that, specifically, word for word, mentioned that there are not enough health workers in Nigeria. Arguing against that motion means they should have brought up things such as medical facilities or maybe corruption, other things apart from health workers that would have been enough to solve health hazards. We are supposed to argue in favor that larger numbers would then solve health hazards in Nigeria. The second speaker talked about how there are only 25,000 out of 170 million, again, supporting our point for us. And she said that there's movement from rural to urban areas, that there are no facilities. We said that people that leave Nigeria are costing us 30 billion naira. That money can be reinvested into the Nigerian economy if we have larger doctors to reestablish more trust, to stop people from leaving Nigeria, so that we can then build more facilities in the rural areas so that doctors no longer move from rural to urban areas. So in all senses, more doctors, more physicians, more health workers, everything agrees with our point. I don't have anything else to rebut. Thank you.
The topic says, the large number of physicians and health practitioners in Nigeria, both public and private, are enough to solve, and your stand is to support this motion. So my honorable opponents, you're supposed to tell us that the medical practitioners in this country are sufficient enough to solve the health hazards and not against. My first question, your first speaker talked about, he said, what is a school without teachers, hospitals without doctors? We all know that we have schools without quality or sufficient teachers, and we have hospitals without sufficient health workers. Therefore, how does the existence of hospitals prove the sufficiency of health workers? 2, you said 1 to 20,000 people in Nigeria, that's the patient or doctor-to-patient rate. Please, I would like to know your source, because from my source, the Vanguard publication, I got 1 to 53,333. Third, medical schools, from my research, I learned that medical schools in Nigeria is permitted to admit at most 200 students to the Faculty of Medicine. And he talked about corruption, that corruption should not be a hindrance in employing medical personnel. I want to ask, will you employ people that don't exist at all? Because we are the schools to bring forth medical personnel that should solve health hazards in our country. 4, your second speaker made a funny quote, and he said, now since morning we dey wait, doctor never come. I don't know how the statement means to you, but to me, you are furthering buttressing our point that we lack medical personnel in this country. 5, to support that medical personnel are enough, you said, the third speaker said, she wants to support that medical personnel are enough, yet all your points were almost the direct opposite of what you said. Therefore, please, I would like you to clearly understand your point, and if you would help us to explain your stand in this motion. Thank you.
The topic with me is United Nations Development Program, UNDP, in Nigeria can only be adjudged effective when its projects are invested. Veritas University are speaking for, while Nigerian Turkish Nile University are speaking against. Thank you.
Only when the leaders of tomorrow are put at the core of the activities and the projects of the United Nations Development Program can they be considered effective. But first, good day, the judges, the team from Nile University, and the audience. I am Vincent Naboro, a third-year student of Post-Science and Diplomacy in Veritas University, and I'm here to lay credence to the fact that the United Nations Development Program can only be adjudged effective only when their projects are centered on the development of the leaders of tomorrow. First of all, it is not the sustainability of the programs, but when the programs are implemented and effective measures are taken to put in place these programs. I will start by clarifying the concepts. I'll use the term youths here to classify the leaders of tomorrow, who are people between the age brackets of 35 to 1. According to the National Bureau of Statistics,